In this video I'm going to share with you my story that was actually quite dramatic and life-threatening, and why I would never live in a smaller city outside of Makati. About 10 years ago I arrived in Makati for an annual vacation, and I was not able to go to the bathroom. I had what they call urinary retention, and I could not even sit down, and couldn't take a taxi, nothing. So I walked from my hotel in Makati over to Makati Medical Center, with one of the staff from the hotel. The nurse hooked me up to an IV, which was incorrect. When somebody has urinary retention, you don't want to put more fluids in their body, because that will make it even worse. To make a long story short, it was very, very painful. I had a lot of bleeding, and eventually they sent me straight to the emergency operating theater, or the place in the hospital where they do surgery. The doctor basically saved my life. It was life-threatening, and I would have died unless he intervened. They couldn't get a catheter to work, and he basically had to bypass by cutting open my bladder and taking out the blood and the whole all the things that were clogging up the urinary system. So that was a very serious adventure, and I would have died unless they saved me in the Makati Medical Center. If I was out in Boracay or in a smaller city, yeah, I would have passed away for sure. That was very serious. So that incident taught me never ever go and live in a smaller city. In Makati, the medical system is not up to international standards in the smaller areas, smaller cities. And that's why I would never ever live anywhere else except Makati, because of the two international standard hospitals. St. Luke's is one, and Makati Medical Center is the second one. So I can pretty much walk or take a car, taxi, or anything else with just a few minutes of ride and be at the top medical services in the Philippines. I would just be totally nervous if I lived in a smaller city with no backup plan in case of a medical emergency. It's very easy to come to the Philippines and be young and healthy and say, yeah, I'll never ever have an accident or a medical emergency. But to be on the safe side, you should think twice about going out to a remote island in the Philippines without any backup plan. If something happens, should you have a serious motorcycle accident or a heart attack or stroke, you don't want to experience that. So this is my recommendation for you guys. Get into a city and make sure you have access to proper medical care. A medical doctor of mine, a friend of mine in California, once said he would never ever be caught going to a hospital in the Philippines, not even for a cold. And that's true if you live in some of the smaller cities. The medical quality is substandard, no offense, but the medical service in the big city like Makati, a smaller area of Metro Manila, is very good. It's actually better in some regards. I would say for customer care and the doctor spending time with you to explain what's going on is better in the Philippines than it is in the US. And of course the prices are probably about 20% of what they are in the US for the same service. As an example, my doctor, functional medicine doctor in the Philippines, he charges about 1,200 pesos for a routine visit. In the US, yeah, I would pay 5 to 10 times that. And he actually spent an hour and a half with me on the first visit, and he routinely spends about an hour each time I'm there in the US it would be almost impossible to get more than 10 minutes with my doctor. No offense to him, that's just the way the system works in the US. Unfortunately, they are just stressed for time, and money seems to be the only game in town, and they want to squeeze as many patients in per hour as possible. My doctor in California is very good, but it's hard to get more than 10 minutes out of him each time I go to visit. So that's the big benefit of going to the Philippines. You have doctors that are not only trained in Australia or Europe, and they are high quality if you go to the right places, like Dr. Stanley Chua. He's a functional medicine specialist in Makati, and I can highly recommend him. And for you guys that are not familiar with functional medicine, you should know that it's significantly different than conventional treatments in the way that it tries to treat the cause, not the symptom. And if you think about it, when you go to a doctor and you tell them you have high blood pressure or you've got cancer or something like that, usually the traditional approach is to cut out the cancer or squash the symptoms of the cancer so you can get back to living your life, which is all right for a certain time. But if you really want to get rid of the cause of the disease, you need to dig deeper. For example, you might have high blood pressure and your doctor finds out you are low on vitamin D, or could be a number of other reasons, right? It's not just a matter of giving you a Western medicine to dilate your blood vessels so you have lower blood pressure. You might have inflammation from being allergic to certain type of food, and that's the real cause for the high blood pressure. Or it could be stress. Maybe you have a stressful job, so the functional medicine treatment would include talking and discussing and researching and finding out the real cause of the disease. And that's what my functional medicine treatment does in California, as well as in Makati with Dr. Chua. I can highly recommend him, and here's what he's got to say. Okay, so I'm here in Dr. Stanley Chua's office, and I want to ask him, what is functional medicine? How can it benefit expats that might be living or traveling to the Philippines?
Well, functional medicine is an approach towards managing disease. You know how a lot of us are actually very frustrated with the medical system where, we only get a 5-minute consult with our doctors and there really isn't much time to ask questions and there really isn't much time to delve into the deeper details of how we can manage our diseases through lifestyle changes, sleep, exercise, and even nutrient support like supplements. Functional medicine is actually a tool that helps us address these deficiencies in the medical system by providing our patients with the adequate nutritional advice, adequate supplementation, exercise tips, and even sleep management so that they can actually overcome their illnesses. It's a very holistic approach, and if you're looking for a holistic approach to actually help you manage your disease and you're looking to get rid of your medications, get rid of a lot of the prevent a lot of the surgeries that are not necessary anymore. Functional medicine is actually a tool that can help you achieve those goals.
Why would somebody traveling from the US even consider that in the Philippines as an alternative, or while he's staying here? Is it like preventive care, or is it more like functional medicine is only put into use after there's some problem to address?
Well, functional medicine can actually be used for both. You can actually use it as a preventive tool so that you can prevent a disease, especially if you know already your genetic predisposition towards a particular illness, for example, cancer. So we can use some elements of nutrigenomics or some genotyping, where you can determine the actual risk for certain diseases. Now, it can also actually be used as a method of managing a current problem or disease state, which I've already mentioned. And with functional medicine, most of the time we do see a lot of patients that already have very well established diseases, but they're looking for better solutions. And in the Philippines, one of the advantages we have here is that, well, one, the cost of care is actually cheaper. We don't, our doctors here are very compassionate, and our doctors here actually can really actually spend the time with you to talk to you, and encourage you, and to really motivate you to actually go into the plan, move with the plan, and actually carry on with the plan, even while you're moving abroad, even when you're moving to a different country.
Why should an expat that may already have health insurance and medical care in another country, why would he consider coming to your office or a functional medicine office in the Philippines?
Well, I think one of the biggest advantages of having your medical care in the Philippines is actually the quality of care that we have here is equal or even in excess of what you have in the more advanced countries. We do follow an American system of medicine, and so the standard of care is pretty much American as well. Now, if you're looking for other solutions that encompass beyond medications, functional medicine, and a more holistic care, other holistic methods such as acupuncture, Chinese medicine, are actually very, very widely available in our country. And so this is one of the reasons why I would encourage a lot of the expats, a lot of foreigners to actually come and visit our clinics, come visit other functional medicine centers, so that you can experience a complete Filipino type of care.
Okay. Now, one of the big benefits of living in the United States, California, is you have easy access to vitamins, not only in the stores, they're a little pricey, but in quantities and good prices on Amazon.com. You can ship it anywhere in the world, but there are international shipping charges that can be quite large. However, if you're living in the Philippines and you want it quickly and low cost or fairly low cost, you can go to Johnny Air Plus, and just as an example, for a £1 package of certain dimension, it'll cost you less than 1,000 pesos to arrive within a week or so. So I tried it one time. It was very good. I picked it up from the head office in Makati. They have about 9 or 10 different locations in the Philippines that they work with at the moment, but I can highly recommend this service. Very good way to get inexpensive vitamins shipped from United States. It's a little bit hard to get good quality, or should I say low price, vitamins in the Philippines. So there you have it. If you prefer to live a long life and stay healthy, live in Makati near the two major hospitals in the Philippines. If you're 21 years old and you're adventurous and you've never had any health issues and you don't plan on breaking a leg, yeah, by all means go and live out on one of the islands and be willing to take the risk on surviving an accident with a motorcycle or something like that. But if you're older and you just want to stay healthy and reduce the risk for any emergencies, or at least be able to deal with any emergencies that come up, stay close or live close to one of the major hospitals, and there's only two really good ones, and they're both located in Makati, so that says a lot. And regarding functional medicine treatments, yeah, that's the only way to go. I'm not interested in the trying to treat the symptom rather than the cause. You should always try to get to the cause of any medical symptoms that you have, and the only way that I know of is alternative medicines like Eastern medicines, or use a Western doctor that's been trained in functional medicine, which is all evidence-based. I'm an engineer by profession, so I don't just go by sweet words and old wife tales, or there might be something to it. I like to see evidence for some treatment before I buy into it. So the functional medicine practice seems to be very scientific and gets into all of the things that might possibly be a solution and treating the cause of your symptom.